In this presentation, cannabis and cancer will be discussed. Cancer and cannabis, an overview and a heads up. Currently, there are no published standardized dosing for organic cannabis due to different concentrations and ratios of different types of cannabinoids in various types of plants, methods of growing, and delivering methods. Most of the research has been done on synthetic derivatives of cannabis. Different responses to cannabis depends on the patient's constitution, typing, staging of cancer, method of delivery, and types of chemotherapeutics. Symptoms associated with cancer and cancer treatment are as follows: weight loss, anorexia, pain, anxiety, depression, nausea, vomiting, and insomnia. In our own bodies, we have endogenous cannabinoids. Here are two of the following. There are two prominent cannabinoids found in cannabis. They are CBD and THC. Why cannabinoids work? In our body, we have two receptors, CB1 receptor and CB2 receptor. CB1 receptor is identified in the brain, and it is found in high concentrations in areas involved in processing of noxious stimuli. CB2 receptor is predominantly located in cells of the immune system, and it likely has a role in controlling inflammation and cell proliferation. Mechanism of action of cannabis. Endocannabinoid receptor activation leads to modulation of mood, appetite, motivation, inflammation, insulin sensitivity, fat and energy metabolism, memory, immune modulation, and pain. The pain mechanism of action is as follows. There is modulation of neural activity in the medulla, anti-nociceptive effects in the descending pain pathways, and anti-inflammatory properties through prostaglandin synthesis inhibition. There are known mechanisms responsible for action of apoptosis by cannabinoids. THC leads to the CB1 or CB2 receptors, and from there is a ceramide synthase, which in turn upregulates P8, which leads to subsequent induction of apoptosis. There are numerous different pharmacological actions of cannabinoids. They include antiproliferative, anti-cancer, anti-emic, antibacterial, analgesic, antipsychotic, anxiolytic, and neuroprotective. Cannabis as an anti-cancer agent. In 1975, NIH investigators reported that delta-9 THC, delta-8 THC, and CBD inhibited lung adenocarcinoma cell growth in vitro and in mice. Cannabinoids curb growth of various tumor xenografts in mice: lung, breast, colorectal, and pancreas carcinoma, skin carcinoma, melanoma, thyroid epithelioma, lymphoma, and glioma. There are types of cancers that respond to cannabis, and they are as follows: breast cancer, prostate cancer, lung cancer, brain cancer, skin cancer, and others. The types of cancers, there are different mechanisms and pathways through the CBD and the THC. For example, for breast cancer, through the CBD, there is ER stress, ERK, and receptive oxygen species ROS pathways. Through the THC with breast cancer, it blocks G2-M phase transition, activates the transcription factor JUND. And there is also the prostate cancer, lung cancer, and cervical cancer as well. Glioblastoma multiforme. THC inhibits proliferation of cancer cells as well as induces apoptosis. THC inhibits cell proliferation by downregulating of E2F1 in human cells. Chemotherapy-induced nausea and vomiting. Throughout the years, as can be seen, there are different synthetic of THC products developed to help and are approved for chemotherapy-induced nausea and vomiting. Chemo-induced nausea and vomiting is experienced to some degree by about 70 to 80% of chemotherapy patients. Chemo-induced nausea and vomiting is associated with decreased appetite, reduced caloric intake, which can lead to metabolic disruptions, CATSCA, unintended weight loss, anorexia, and dehydration. Level of evidence. Through our research, we believe that cannabis, the efficacies but safety is inconclusive, which lands in category C. There is report that low dose of cannabinoid administration accelerates proliferation of cancer cells instead of inducing apoptosis, and thereby contributes to cell cancer progression. Till date, very little is known about the mechanism of action in this particular part. Therefore, more research is necessary before safety efficacy can be concluded. Is cannabis legal in the US? Yes, but it depends, because legal access varies from state to state. Here is a list of states which enact laws allowing medical use of cannabis. This following slide is about laws specific to Arizona. For example, state licensed doctors are able to recommend medical marijuana to Arizonians that have at least one qualifying conditions. There is different dosing in cannabis research. There is low, moderate, and high. In low dosing, it's less than 7 milligrams. In moderate dosing, it's 7 to 18 milligrams. And in high dosing, it's greater than 18 milligrams. There are different cancer dosing guidelines. For chemo-induced nausea, vomiting, appetite stimulation, pain, sleep, and anxiety depression, there are different levels of THC utilized, and they are listed here. Cancer specialists recommend the use of cannabis. 82% of oncologists indicate their belief that patients should have access to cannabis. There are different common and adverse effects to cannabis. They include dizziness, redness of eyes, decreased eye blink rate, anxiety, dry mouth, sedation, and changes in visual perceptions. There are different drug interactions with warfarin, alcohol, theophylline, and CNS depressants, and this slide indicates what those interactions are. And these are references utilized.